currently employed?
I am, yes ma'am. I'm a doctor at Methodist Hospital here in Lone Star.
You mentioned you're a doctor. Where did you receive your undergraduate training?
My undergraduate training was at Tulane University.
What about medical school?
Medical school, I went to medical college here in Lone Star.
What year did you graduate?
I graduated from medical school in 1994.
So how long have you been practicing medicine now?
Well, I was certified after completing my residency in 1998, but I started my residencies 1994, so I've been working since 1994 in the medical field.
So what professional appointments have you gotten after your graduation from medical school?
Well, as I said, I'm certified by the Board of Emergency Medicine, and I'm currently serving as the Director of Emergency Medicine for Methodist Hospital here in Lone Star.
What, if any, professional affiliations do you have?
Well, currently, as I said, I'm the Director of Emergency Medicine. I'm also a Professor of Emergency Medicine at the Medical College. I've also served as Emergency Medical Director for the Lone Star Cowboys, and I've been current chairman of the Emergency Disaster Medicine for Lone Star as well.
You mentioned that you were the physician for the Cowboys. Can you explain that a little bit?
Yes, ma'am. I was their sort of on-field emergency physician for players, both in practices, games, things like that.
So what kind of injuries did you see on the football field?
Kind of you name it: sprains, breaks, head injuries, shoulder injuries, things like that.
So how firm would you say your grasp of emergency medicine is at this point in your career?
Emergency medicine, I would say, very substantial. It's kind of like an old hat, I guess. I've been doing it for so long.
Now, what is your involvement in today's case?
I was the treating doctor for Miss Testa when she came to the hospital, or when she came to the emergency room.
And do you use reliable principles in the field of emergency medicine?
Yes, ma'am, we do. As long as they're approved by the Board of Emergency Medicine, that's what we use.
And did you use those reliable principles in this particular case?
Yes, ma'am, we did.
And did you review all of the relevant documents and testimony before you got up on the stand here today?
Yes, ma'am, I did.
Your Honor, at this time, I would like to offer Dr. Derek Shepard as an expert in emergency medicine.
Any objection?
Yes, Your Honor. We would object that this witness is merely a fact witness. He is the doctor who saw Adriana Testa on the night of the injury. He was not hired as an expert in this case. He's merely testifying about the injuries as he saw them on June 14, 2014. Therefore, it would be improper for him to be an expert in today's case.
Any response?
Yes, Your Honor, if I may. The doctor we have charged the defendant with first-degree assault, and in doing so, we have to prove that Ms. Testa was suffering serious bodily injury, and to be able to make the determination of serious bodily injury goes beyond what a lay witness can do, and therefore the doctor is essential in determining that the actual fractures that he did observe that night were serious, and that they were consistent with a hammer.
Any response?
Your Honor, if the doctor is going to testify that these were serious bodily injuries, that's an improper opinion, even if he was an expert in the field of emergency medicine. Serious bodily injury is a legal definition, and that's for the jury to decide based on the facts that they're given. He's just here to testify as to the injuries he saw that night. A conclusion that would be legal in that nature would be improper.
Response?
Yes, Your Honor. As we already went over in pretrial motions, the doctor is not testifying for the purpose of determining in the legal sense whether or not this was a serious bodily injury per the terms of the statute. However, for the crime charge, we do need to prove that her injuries were serious. So the doctor needs to be an expert in order to come to that conclusion that her injuries were serious. Yes, he is using facts, but he's using the facts that he observed that night in order to come to a medical conclusion.
I'm going to sustain the objection. He is allowed to testify as to what he observed as the treating physician and what his diagnosis was from his observations, but he's not allowed to be qualified as an expert.
Yes, Your Honor. And just to clarify, may the doctor then classify her injuries as serious from a medical perspective?
No.
Okay.
I say that that would be an expert opinion. He's allowed to testify as to his, I guess, more basic observations, the way that he read x-rays and such, if there were any, but beyond that, he can't give any of his, I guess, concluding opinions.
Thank you, Your Honor. Dr. Shepard, tell us about the night of June 14th. What happened that night?
Well, it's kind of a normal night in the ER. A lot of patients came in or whatever. More specifically, Ms. Testa came in. She was dropped off by an EMS staff after they picked her up somewhere not too far from the hospital, but she was brought to my attention as the attending physician at that time.
And how was Ms. Testa acting when she first came into the ER?
She seemed quite frightened or sort of out of sorts when she came in. She presented to me with 3 wounds to her head, as well as some abrasions and lacerations to her palms, as well as the front part of her legs.
Now, just backing up a little bit before that, did you run a tox screen on Ms. Testa?
Yes, ma'am, we do. That's kind of what we do with everybody that comes in.
And what did that show?
It came back dispositive for drugs and things like that. There was some alcohol in her system, and there was some amounts of Xanax. However, she's prescribed Xanax, so that's sort of to be expected.
What, if anything, did Ms. Testa do that made you question whether or not she was actually drunk?
She didn't seem drunk or intoxicated to me at all, as well as the fact that the screening came back negative for other drugs and things like that. I mean, if she had a drink, it would have been, not enough for me to think she was intoxicated.
What did you come to learn about the head wounds that you mentioned earlier?
That they were sort of consistent with trauma of a sort of a blunt object like a hammer.
And what was your diagnosis?
My diagnosis was that they were fractures to her skull, that she had been hit by a hammer.
Objection, Your Honor. Improper opinion, as this witness has not been entered as an expert. The consistency with a hammer would go beyond that of a lay witness.
Any response?
Yes, Your Honor. Even though he is not entered as an expert, he still used facts that Ms. Testa told him to form a conclusion that I believe he can testify as to her diagnosis.
I'm going to sustain that objection. I think he can testify as to the fact that the reports were showing him that there were fractures, but not as to the cause.
Yes, Your Honor.
As he would be getting that knowledge through somebody else and not off of his first-hand knowledge.
Thank you, Your Honor.
Move to strike that statement, Your Honor.
Yes.
Now, you mentioned she had fractures. What kind of fractures did you think she was suffering from?
My diagnosis would have been a simple depressed fracture.
And what does that mean?
Multiple. It's a fracture that doesn't actually bleed. There's no breakage of the skin. However, the underlying bone is fractured.
So what, if any, bleeding is associated with the simple depressed fracture?
There's no external bleeding. So there can be internal bleeding, but that would not present on its face from a sort of superficial examination of the patient.
And did you order any follow-up tests for Ms. Testa?
Yes, ma'am. She had a CT scan done to check for fractures.
And what were the findings of that CT scan?
The CT scan came back negative for fractures.
And what are your thoughts on that CT scan?
My thoughts are that they can be misread, and it's possible in this case that they were misread. It depends on the technician that does them and gives them back to us for medical records. As I've said before, my diagnosis was that she had a simple depressed fracture or multiple simple depressed fractures to her skull.
Thank you, Your Honor. Thank you, Dr. Shepard. And so you said that you didn't agree with the finding of the CT scan, but what did that CT scan not show?
It did not show evidence of serious brain injuries, which is actually consistent with simple depressed fractures. That would have been sort of common, and in conjunction with that, we treated her for concussion-like symptoms, which is something that would have been consistent with that. The fact that there were no fractures that showed up on the CT scan results.
How long did Ms. Testa stay in the ER that night?
She left that night. We ordered her to stay, or asked that she stay the evening for monitoring, but she was cognizant enough to take herself out of the hospital or check herself out, so she did so. And we're not able to force patients to stay in the hospital if they can check out under their own, accord.
And when Ms. Testa left the ER, did you send her with any paperwork?
We gave her paperwork to kind of monitor her symptoms, as I've said, for concussion and things like that, and essentially those papers kind of give patients symptoms to watch for, and if they get worse, to come back to us.
Dr. Shepard, how confident are you that Ms. Testa obtained adequate medical care on June 14th?
Positive she did.
How are you positive? How do you know?
Because I did it, and because we followed the standards that we're supposed to.
And what is your diagnosis of her today? Do you think she's in adequate medical health today?
I do, yes. I mean, the fact that she's here shows that she received the appropriate medical attention that she needed for the injuries that she sustained.
Nothing further, Your Honor.
Cross?
Yes, Your Honor. Before I begin, I'd like to address the motion in limine that was made and held in abeyance, so that I don't go into that, so I ask that the jury be excluded so that we can discuss that motion.
Okay.
This is as to the prior, his medical history. I wanted to ensure that I will be able to cross-examine the witness on that, as this will go to Ms. Testa's credibility.
Any response?
Your Honor, the alleged bipolar disorder, again, there's no medical proof to show that she ever had any of these symptoms, including the bulimia and the cutting. Introducing this would only be to prejudice the jury against Ms. Testa. And if she even thought that she had bipolar disorder, that doesn't affect her credibility. It doesn't make her any less credible or any less of a victim today. We ask that we continue stating, Your Honor, that it is inadmissible testimony.
Any response?
Your Honor, the diagnosis or self-diagnosis of bipolar disorder, along with bulimia, cutting, this goes to the instability of Ms. Adriana Testa, the condition that she had that night, and the credibility of her statements, especially combining this with the intoxication, as I will get into. This will go to the credibility and the amount of weight that the jury can give to the statement she made that night.
Okay, and then under the federal rules of evidence, if you're using impeachment evidence, do you need to give the witness the opportunity to confirm or deny that before bringing it in through outside sources?
Well, this isn't impeachment evidence, Your Honor. This is just goes to the prior medical history of her. We're not using this to impeach anything that she had said before, but rather just to explain her stability that night when she visited the doctor. And this also goes to the weight that he gave when she told him this information that night.
Any response?
Your Honor, again, they said it themselves, credibility. That is impeachment, trying to show her veracity for truthfulness or untruthfulness to make her look like an untruthful and not credible witness. They are trying to impeach her without asking her at all about her own medical history before going into it with the doctor. And again, under 403, the probative value is substantially outweighed by the prejudicial effect. Further, I would say it's also 404, Your Honor, improper character evidence, trying to make her look unstable. That's a character trait, and they didn't bring it up during her own questioning. So it's inadmissible now.
Your Honor, Rule 404 for character evidence allows the defense to go into her credibility based on these types of prior medical history. It does not require that we approach her with these. These are the statements that she made to the doctor, and therefore it goes to her credibility and the weight that he should have given them when she mentioned them to him that night.
Your Honor? Yes. Sorry, Your Honor. These statements are outside of court statements. These were not statements in a sworn statement. These were not statements she was allowed to testify to today in trial. They are inadmissible.
I'm going to split the baby on this one, and they will not be admissible as to the witness or as to Ms. Testa's credibility or necessarily her mental state at the time, but I will admit them for the limited purpose of how that affected the doctor's treatment or diagnosis in this case, and I will give a limiting instruction to the jury as to such.
Thank you, Your Honor.
Now, Dr. Shepard, I'd like to talk about a statement that you made on direct examination Ms. Testa was bleeding when she came into your office,
The wounds to her head were not bleeding.
and you found no evidence that the wounds to her skull would have been bleeding that night.
I did not find any evidence.
And so none of the medical records you reviewed would have shown that she was bleeding from the head wounds.
I believe the EMS report from their technicians says that she was bleeding, or that there was blood on her head, but she also had bleeding or wounds that would have been bleeding wounds, or wounds that would have bled on her knees, legs, and hands. So it's very easy that she could have put blood on her head from her other wounds, specifically from her hands.
But when you were reviewing these documents, preparing for court, and coming to a conclusion about her injuries, you actually saw that she was bleeding from those wounds, that is what the EMT had observed.
Correct, but that's the EMT's observation and not mine.
So you discredited that.
I didn't discredit it. I mean, we went through a rather thorough examination of her, so I would have easily been able to see if her wounds were bleeding while she was under my care, and they were not.
So you discredited the findings of the EMT, even though they were in her medical records.
No, they just were not. They were not consistent, or they were not ongoing as I saw them while we monitored her.
Now, I'd like to talk about some other statements that you were provided with that night. Ms. Testa told you that she had a history of bipolar disorder, correct?
Yes, ma'am, she did. I don't believe she ever provided a medical diagnosis, nor were they in her medical records, so it was a self-diagnosis. People do that all the time. They think they have something that they don't necessarily have.
But she did tell you that.
She said that she thought she did. Yes,
And she told you that she had a history of bulimia,
yes, ma'am.
and that she had a history of cutting.
Yes.
She also told you that she had been drinking that night, right?
Yes, ma'am. She did.
And she was prescribed to Xanax.
Yes.
Now, intoxication, that could make someone unbalanced, couldn't it?
It's possible if intoxication is substantial enough, yes.
And intoxication mixed with drugs like Xanax, that could cause someone to fall, couldn't it?
That's correct. I mean, the fact that she's prescribed Xanax can be in the system for, depending upon the person, for any amount of time. So our examination does not indicate when she took it.
But if Xanax is mixed with alcohol, it's possible it could cause someone to fall, right?
It's
Objection,
possible,
Your Honor,
yes.
asked and answered.
Response?
Your Honor, the witness did not answer that question. He went back to whether or not she was taking both that same night. I'm just clarifying if both of those are taken at the same time, whether or not that could cause someone to fall. I don't believe he's given a yes or no answer to that yet.
Overruled.
Now, mixing Xanax with alcohol, that could cause someone to fall, couldn't it?
It's possible, yes, ma'am.
And you do believe that Adriana Testa fell on June 14, 2014.
The scrapes on her hands, knees, and shins are consistent with that, yes.
And she told you she fell that night.
Yes, ma'am.
Now, I'd like to talk about some other findings you have. You, at first, just diagnosed a possible skull fracture, right?
Correct.
And that's because you have to order a CT scan to determine if there's an actual fracture, right?
Yes.
And it's typical for CT scans to be performed in the medical field,
Yes, ma'am.
in the field of emergency medicine.
Yes.
And as a medical director, you're familiar with reviewing these documents.
I am, yes, ma'am.
And these are kept at your facility,
Yes.
and they're taken at or near the time of the CT scan.
Yes, ma'am.
And the results are stored at the place where you are a medical director.
Yes.
And you recognize the results of the CT scan if I were to show them to you in court today.
Absolutely.
One moment now. I'm showing opposing counsel what has been pre-marked as Exhibit 12A for identification purposes. Permission to approach the witness with the same document?
You may.
Now, Dr. Shepard, I just handed you the results of the CT scan that you reviewed for today's case. Isn't that correct?
Yes, ma'am, that is correct.
And it appears to be fair and accurate.
It is, yes.
It's the same CT scan you reviewed on June 14, 2014.
Correct.
It doesn't appear to be changed in any way.
No, ma'am.
Your Honor, at this time, the defense offers Exhibit 12A into evidence.
Any objection?
No objection.
So entered.
I'd like to talk a bit about the results of the scan. You said that a CT scan can reveal fractures, but this actually reveals no evidence of a fracture. actual exam that was run on Miss Testa's skull
It is, yes.
the same night that she came in,
It is, yes.
and it says that there are normal results.
Correct. Yes, it did not show. It presented as normal, meaning that there were no severe fractures or bleeding
But
that showed up.
it actually says no evidence of any fractures. Isn't that true?
That is correct, yes.
And although you disagreed with this finding, you didn't speak with the technician who wrote that result, did you?
No.
You didn't go and pull the actual scan itself.
No, but that's not part of our normal procedures.
And you didn't order a new scan when you disagreed with this one.
No, ma'am.
You merely wrote nonsense across the page.
Actually, I wrote nonsense has to be wrong, saw fractures.
So that's the only way you dealt with this being an inaccurate result, in your opinion.
Correct, yes, ma'am, but the patient also left the hospital.
Now, I'd like to talk about those discharge papers. You actually listed the only condition that she was suffering from as a concussion.
That's correct, because that's how one would treat, or a medical doctor would treat, a simple depressed fracture that shows no substantial traumatic brain injury.
So the simple answer is there was not a condition of a fracture listed on those discharge papers.
Not on the discharge papers, but that's the way that those types of fractures would have been treated.
And another test that you ran were 2 blood cultures. Isn't that true?
Yes, ma'am, correct.
And you never followed up with those results.
Not to my knowledge, as I've said, the patient left the hospital and she discharged herself, and she's here today. I think she's okay.
So the simple answer is you never followed up with those results.
Correct.
But the results you did follow up with were the toxicology screen, correct?
Yes, ma'am.
And those revealed that there was Xanax in her system
Correct.
and alcohol in her system.
Correct.
Thank you. I have no further questions. Permission to approach, retrieve, and publish this document to the jury? Yep.
Yes, sir. Dr. Shepard, the defense counsel talked to you a lot about Ms. Testa's talk screen, but can you talk about how that talk screen, or what was found on that talk screen, seemed to be affecting her when you observed her?
In my analysis of her, nothing that was in her talk screen seemed to be affecting her.
And what was your opinion of that CT scan?
My opinion was that it was incorrect, that there were fractures, simple depressed fractures that did not show up on that scan.
So how do you treat a simple depressed skull fracture?
They're they're treated the same way that concussions would be treated, which is the paperwork that we gave Ms. Testa when she left.
So what was your diagnosis of Ms. Testa that night?
That she had simple depressed fractures to her skull.
Nothing further.